Welcome to the Enjoy a Cancer-Free Life podcast with Dr. Ted Koren, best-selling author of Cancer is Natural, So is the Cure. More than care for patients, Dr. Koren transforms lives. He teaches people an all-natural way to heal from and address the causes of cancer using the tools we all have within ourselves. On the podcast, Dr. Koren interviews other thought leaders in natural healing who share insights and information to help you live longer and better.
I think it would be really good to start with because a lot of people don't know your work and how incredible you've been and so many lives you must have saved. So why don't you tell us a little bit about your education and background and where you came from and how you got this way?
Oh, I'm a Southern Mississippi boy, Notre Dame High School, then Johns Hopkins University, Tulane Med School, and ultimately, crazy enough, the Denver College of Law for my law degree. But I practiced traditional mainstream cardiology for about 15 years, and after leaving New Orleans, and then I moved to Colorado, and after a couple of years there, circumstances put me in the company of Dr. Hal Huggins, a truly maverick dentist, probably the world's first true biological dentist, anti-amalgam and following in the footsteps of Weston Price with regard to root canals and infections of the teeth. And I had the opportunity to see things happen in his clinic that my medical training told me were impossible. And so I was left with the decision of, are you going to believe your lying eyes, or are you just going to toe the line and believe things that you have no idea whether they're true or not? So I chose to believe my lying eyes. I saw Dr. Huggins do things with intravenous vitamin C that I'd never heard of before. But as soon as I saw the responses, I said, well, my lying eyes are telling me I have to start doing a little research here and figure out this whole concept of vitamin C all on my own. That began my research on vitamin C a year or two later, mainly for the concept of self-preservation, I suppose, since I saw Dr. Huggins go through an enormous amount of, shall we say, garbage. I went ahead and got my law degree from the University of Denver. And
You mean legal attacks?
legal attacks, yes, sir. So here I am now, about 12 books and a couple hundred lectures and maybe 1,000 interviews later. So here we are.
Well, sounds like you've been pretty lazy to me. So that's, not easy for someone to start to questioning their education. In a way, it's been written, I remember Robert Mendelsohn, the famous pediatrician, wrote that medicine has become a religion. He calls it the Church of Modern Medicine. And because his first book was Confessions of a Medical Heretic. And he was once asked, he said, how come you call yourself a heretic? You're a critic. He says, well, a heretic is someone who questions and even goes against his belief in his religion. And since medicine has become a religion, he's become a heretic. So I thought that was a nice phrase to use. But you became a heretic using that terminology. Was it difficult?
No, it had, again, I'm not trying to give myself big pats on the back, but no, I mean, I've never been reluctant to do what I think is right. Now if I know something is right and it's going to get me shot, I might not do it, or get my family in trouble, or get me audited nonstop by the IRS, or this, that, or the other. I mean, I try to put a little bit of practical intelligence in there, but I've never been reluctant to take what I think is the right path because I'm afraid of what other people will say. That really just, I mean, I like to be liked, I like to be supported, but it really means nothing to me if I know what I'm doing is right and somebody else chooses to take pot shots. It just doesn't matter.
How did you get involved in the dental aspect of health? Obviously, it's incredibly important, or you wouldn't have taken this path.
Well, it's all Dr. Huggins. I mean, he had this dental clinic. He got patients in from around the world. They stay there for 2 weeks. I saw abnormal blood work normalize oftentimes in 2 weeks or a few weeks to a few months later. After all the dental infections and toxicity were taken out, the mercury was removed. We did a number of research studies on our own and combined forces on that. And it became readily apparent without having being slapped across the face is that, and I was only able to learn the reasons why later on, is that infections cause most chronic disease. And they cause most chronic disease because they're the biggest sources of oxidative stress. And oxidation is all disease, and 95% of chronic infections are in your mouth.
95%.
At least, yes.
What percentage of the population would you say have chronic dental infections?
Well, I would say above the age of 50, probably, depending on the population. That was part of the research of one of my books. Different populations with higher than others, but if you just take an average across the way, I would say between 40 and 60%.
And this leads to chronic illness that we see.
Absolutely, absolutely. I now have my own ongoing theory, if you will, is that all chronic disease is really an excess of oxidation over reduction, so that you're limited by how much you can repair with antioxidants because you're continuing to supply new oxidizing agents on a daily basis. That brings in the chronic infection. Dr. Huggins used to tell me all the time, Tom, yes, sir, you can't dry off while you're still in the shower. And that just made so much sense. I mean, here we are vigorously trying to repair oxidized biomolecules, but we haven't turned the water supply off. We haven't turned off the new influx of brand new potent oxidizing agents on a daily basis. So all effective clinical protocols for any disease has to be prevention balanced by repair.
So you use the word potent oxidizing agents.
Right.
Other people have said toxicity. Is there much of a difference?
They're identical. And that's something I try to make a point of in my books and in my presentations, is that toxin, pro-oxidant, free radical, these are synonyms, okay? The only way a toxin exerts a toxic effect is by oxidation. There's no other unique toxicity to a toxin other than its ability to oxidize a unique array of biomolecules, RNA, DNA, sugars, proteins, fats, etc.
For those people that are not familiar with the term oxidation, can we say rusting is a good thing?
Yeah, and for those who just know a little bit, it's a good thing to remember that there is no sickness without oxidation, okay? You don't just get Alzheimer's disease or fibromyalgia and your cells have somehow this unique disease. All your cells have is a unique array of different biomolecules being oxidized in different concentrations in different locations. That is the disease. There's nothing else to disease other than that. So oxidation is when something takes electrons away from the molecule being oxidized. Reduction is when it restores those electrons. And this is significant because on an individual basis, when a biomolecule, let's say an enzyme, is oxidized, it usually is decreased in function or no longer has any biological function at all. And it's not until you reduce it and give the electrons back again that enzyme, if you will, comes back to life and starts doing what it's designed to do. And that pretty much is the case with all the other biomolecules. It's just that is especially dramatic when you use the example of an enzyme. So, and you might say, well, some toxins kill you in a minute, some kill you in a week, some kill you years later, and just some make you sick. Well, how can that be if all it does is oxidation? Again, it has to do with location. If you inhale cyanide, in seconds, you inhale it, it comes in, and it immediately starts selectively oxidizing the pathways of respiration by which you assimilate oxygen. So a minute or two later, you die from oxygen starvation. On the other hand, you have mercury amalgam fillings in your mouth. getting in a very small amount of mercury, low and slow, but it selectively concentrates in the neurological tissues. So then 10, 20, 30 years later, you start developing very commonly multiple sclerosis and other neurological disease. It all has to do with location, potency, concentration, but everything. I used to say oxidation causes disease, but I got to say now, this might seem a bit technical, but I think it's much more accurate to say oxidation is disease. Your oxidized biomolecule is quote unquote diseased, and your unoxidized biomolecule is normal.
So I had a patient, you're reminding me of many patients. One, she came in with 2 canes. She was 49 years old, she had 2 canes. She just graduated from 1 cane, and they said that soon she'd have a walker. And of course, a wheelchair after that. She was diagnosed with Parkinson's. So I checked her and I found all 4 wisdom teeth were infected. She went to, the wisdom teeth had been pulled, the sockets were infected. She went to a biological holistic dentist, maybe Mike Margolis in Mesa, Arizona.
Yes.
Mike,
Yes.
One of your biggest fans, and I'm one of his biggest fans too. Anyway, he cleaned out all 4 sockets, and within 2 weeks, this woman who had been on 2 canes walked 500 feet without any canes at all. And she said, I don't understand this. I had my wisdom teeth taken out when I was 19, and I'm 49, and now I'm deteriorating. And it just goes back to what you said. Time.
Yes, and
resistance.
a little study I did with Dr. Huggins some years ago was I would routinely see when they would explore old wisdom teeth extraction sites, the dentist would put a little burr against it, and then boom, he'd fall into a hole. And it happened almost every time. So I said, well, we need to check the incidence of this. And so I reviewed 100 of his records, and we found that basically you have, I think, a 75% chance of 3 or 4 wisdom of 3 or 4 wisdom site extraction sites being cavitated. Very, very, very high. And what's even more amazing is, particularly with regard to cavitations, that's something that quote unquote modern dentistry still doesn't even recognize as a legitimate pathophysiological entity, which is absolutely ludicrous. And it just shows how far certain groups, professional, scientific, or otherwise, will put blinders on when it doesn't fit their particular vision of things and the way they should be done.
Dr. Margolis refers to the ADA as the American Dollar Association.
Yeah, that's pretty good. And then by that criteria, there's a lot of organizations you could call the ADA.
Oh, without a doubt. Now, in addition, I think of, when you talk about the oral toxicity, I think of root canals and cavitations. And I think of Dr. Issels in Europe who also mentioned infected tonsils. That can happen.
Yes.
You're familiar with that?
Yes, very familiar. If it wasn't for Dr. Issels, I'd probably be dead right now, because based on his studies, I had chest pain one day and I had been messing around with stuff for years, trying to figure out what was going on, elevated CRP, and I had read Dr. Issels' stuff. And the moment I got that chest pain, I said, I'm not dying with these tonsils in my head. So I had them taken out the next day, even though they appeared normal. The surgeon said, that's really funny. I said, what do you mean? He said, well, when I did the surgery, I went to grab the tonsil on the left side and pus started coming out. That was the same side that I'd had my root canal on 20 years earlier. And it had stayed in my mouth for 10 years and then was extracted 10 years earlier. Yet 10 years went by and the tonsil couldn't heal itself. And that's what Dr. Issels has found, is he found that all his cancer patients that he treated had huge numbers of infected teeth, and he would routinely take out those infections in teeth and then begin his little autoimmune vaccination protocol. And a lot of the patients would get better, but a huge percentage, like 20 to 30% of his patients, then subsequently died of heart attacks. Now, I don't know how Dr. Issels figured this out, but he figured it out. He started taking out the tonsils routinely, And two things happened. He didn't have any more heart attacks, number one. And number two, in his words, 100% of those normal size, normal looking tonsils were severely and grossly abscessed and infected on pathophysiological examination.
That is very big, and no one seems to be looking at it. This is
No, it's
dentists look at
it's
it.
enormous. And what's sad now, well, not sad. I mean, I guess what can be addressed now is, I didn't know about it when I got my tonsils taken out about 7 or 8 years ago, but when you give a series of direct intratonsillar injections of ozone gas of the right concentration, couple sessions over the course of a month, you can show that the C-reactive protein drops dramatically and very much indicates that you're either debulking the tonsil of much of its infection or you're actually allowing the tonsil to resolve. And that's important because if you don't take out the tonsils, and I'm not really recommending that because a tonsillectomy as an adult is one of the worst experiences you can have. Take my word for it. But it gives away, really, because of the fact that, look, heart disease takes care of 50% of the population on the planet. So that's kind of important. I think all adults that still have their tonsils in place that are seeing the dentist, they should routinely have a little tonsillar injection of ozone. And I mean, it would still be their option not to have it done, but I think the dentist should offer it. I mean, this is the ultimate in preventive medicine. Absolutely, it should be part of any protocol by a dentist if the patient has or has had root canals at any time in the past, because the root canals and other asymptomatically infected teeth, which I talk about in another book, chronic apical periodontitis, just abscesses that don't hurt. When your mouth contains these things, in very short order, the venous supply, drainage, and the lymphatic drainage overwhelms the minimal capacity of the tonsils to guard against infections. And then the tonsil goes from being what I call a protector to an infector. It becomes chronically infected, chronically abscessed. And the thing is to this day, though, when you say tonsil disease, most people, doctors included, dentists included, is they immediately think of childhood tonsillitis and the big, ugly, inflamed, red, pitted tonsils. That's not the case here. That's an entirely different pathology. The case here is the tonsils are being fed internally with chronic toxins and chronic pathogens, and they maintain an absolutely normal morphology and for the most part, an absolutely normal size. So physical examination doesn't get you anywhere.
So would these be holistic dentists? I imagine they'd be more sensitive, who would be willing to inject the tonsils with ozone?
Yeah, if there are any mainstream dentists that are using ozone now, I don't know who they are. But it's possible because ozone is getting more and more of a niche in dentistry just in terms of helping sterilize surfaces and blowing ozone gas to make sure where you're going to put a crown on or something like that doesn't have any pathogens on it. So it's being used more and more, but for the most part, you're just going to see ozone with a holistic or biological dentist.
So if a person goes to a dentist who's into this and recommends the ozone be injected, what would be a positive sign for toxicity? What would be a negative sign?
Well, the main sign is really at this point in time. We might find out other things in the future, but right now, when you have elevated body-wide oxidative stress or inflammation, you generally have an elevated CRP test, C-reactive protein. When that goes up, that's an indicator of inflammation. And when you're done everything else, and you're feeling healthy, and you don't have any chronic diseases, and this CRP is like 3, 4, 5, rather than being 1.5, 1 or less, then there's a good possibility, statistically speaking, that you have some chronically infected tonsils. And you'll see it very quickly. You can inject the tonsils 2 or 3 times over the course of a couple of weeks, And if the infection in the tonsils is the reason for the CRP, you'll see it drop fairly quickly and fairly dramatically. And if it doesn't drop at all, then you have an important lead to look for other sources of infection or oxidative stress in your body, because an elevated CRP is never normal and is going to accelerate your path toward all chronic degenerative diseases, cancer, and heart disease. So it's a non-specific test, but a very good test for separating the well from the sick. And finally, injecting the tonsils does no harm at all. It's very, I mean, depending on the dentist, it can be extremely cheap. I mean, just a cc or two of ozone and it's all done in 2 or 3 minutes. Okay, so.
But then for the C-reactive protein, they have to take blood for that?
Yeah, it's a blood test.
Right. Oh, so it has to be a combination.
Right.
Okay, that's important, so people should know that they're getting the blood taken as well as the ozone injection. I have a weird tonsil story. I don't know if you hear many of them, but years ago, a holistic dentist I knew had invited a medical intuitive to come to his office. It's a Dr. Chen, who might be on this podcast series, by the way. By the way, your friend Mike Margolis has also been interviewed here. Okay. So anyway, Dr. Chen, I sat down with him for the first time, takes his finger, and he sticks it into my neck, in my throat, and it hurt like hell. I said, what's that? He said, your tonsils are infected. I said, no, they were taken out when I was like 4 years old. And he said, they didn't get the roots. So I was really shocked. Over the next week or so, the sensitivity totally disappeared. Later, he told me that he put chi, where he indicated that he sort of did a healing for me. But at the same time, I wasn't aware that you could have tonsils taken out and still have a tonsillar infection. Have you seen that?
Yes, and it goes even further than that. His phraseology is pretty good. At the base of the tonsil, even when you get out the tonsil intact, you still have scattered areas of tonsillar tissue that if the main tonsil is severely infected, those can continue to be inflamed and infective. But also you have in your mouth a whole ring of tonsillar tissue called Waldeyer's ring. You have a tonsil at the back of your tongue. You have the palatine tonsils, the regular tonsils. You have something along the side of the palate called tubal tonsils, and they all reach the adenoids at the top of it. So you literally have a ring of tonsillar tissue to hopefully screen pathogens as you inhale them or swallow them. So that being said, there's articles to show that if your tonsils were taken out because they're infected, there's an excellent chance, maybe a little, maybe a lot, that there's also some residual infection of this basically adjacent tonsillar tissue. Like I said, it's not a complete organ ring, but it's enough scattered tissue that is effectively a whole system of tonsillar tissue. And when the main concentration of the tonsil, which is the palatine tonsils, get infected, there's an excellent chance that all the rest of that is going to get infected. And a lot of this tonsillar tissue will also wrap around the eustachian tubes that go to your middle ears, and it's also the root of a lot of people, for a lot of people who have inner ear, middle ear problems, chronic infections, this, that, or the other, is until that tonsillar tissue can either be removed or much more easily injected with ozone, they'll stay swollen and they'll compromise the opening of the eustachian tube and give you a greater chance of chronic infections.
So my understanding of oral infections, dental infections, root canals, etc., is that what grows there are the anaerobic bacteria. That the normal healthy aerobic bacteria, when you cut the blood and nerve supply to the teeth, as in a root canal and other areas, become anaerobic and much more toxic. Do you find that to be the case?
Yes, no, that's absolutely true. The anaerobes appear to be the producers of the most potent toxins that we know. We know how toxic Clostridium are, like Clostridium botulinum toxin, this sort of thing. When they're exposed to air and oxygen, they're fairly benign. Okay, but you take the oxygen away, the metabolism changes entirely, and yes, you have enormously toxic bacteria. this is one reason. It might seem like a little shift off the topic, but this is why some people have such a healthy digestion and some people have such a lousy digestion, is when the gut motility slows down and you're only having a bowel movement every other day rather than twice a day, you have stagnation and you have increased putrefaction, less digestion, and in the course of that putrefaction, you're proliferating anaerobically the same type of Clostridium bacteria that make you sick when you start to proliferate them inside a root canal, for example. So in many ways, a sluggish toxic gut is like a extra oral root canal, if you will.
So this toxic gut being drained, or the toxins being drained ultimately into the gut can cause the biome to be adversely affected.
Absolutely. In my opinion, this is the primary reason for leaky gut syndrome and abnormal microbiomes is the chronic swallowing of the pathogens and toxins, not only from the teeth and tongue, but there's something else I've recently written about called chronic pathogen colonization. You've had your cold, you have your flu, you now have pathogens, for most people, lining the pharynx, lining the sinuses, not proliferating rapidly and being covered by chronic biofilms. So regular measures don't get rid of it, you keep it, you swallow, as the young people say, 24/7 pathogens and toxins, and you keep the gut function deranged. I've also found, I don't have a large study to tell you about, but my experience and some of my closest friends and within my sphere, when you nebulize with a potent biofilm busting agent like hydrogen peroxide, which then kills the biofilm, knocks out the pathogens, multiple occasions, myself, family, and friends, you see an incredible normalization of bowel function like you've never experienced in your life. Most people have, well, they don't have really formed stools. They don't have firm stools, and all that has to do with how normal is your gut microbiome is what determines how normal your bowel movement is, which also determines whether or not you're going to have the stagnation and toxin localization so that you have the leaky gut syndrome and all the other problems that develop it. But my other friend who also got a normalization of the bowel functions had the previously presence of fungal antigens in his urine disappear. So I think too, any sort of fungus infection really comes from a leaky gut and having a predominance of fungi in that microbiome.
Tell me if you've noticed this. Sometimes people have like thick layers of skin going down from their chin to down their throat. You've seen it, I'm sure.
Turkey neck, yeah.
Yeah, the turkey neck. And I was told that they're draining their oral pathology, the oral pathogens from the teeth and gums and what have you. That's the way how the body is helping to drain that out. And if they didn't have that, the toxins could go to the brain and they could have MS or Parkinson's or Alzheimer's. So they're actually lucky that it's draining. But in the process of it draining, it's still causing damage to the gut. Does that sound plausible to you?
Well, not really. I mean, when you have loose skin here, that's still just skin. And the drainage we're talking about is going through lymphatics and other areas like that. So if it played a role, I would have to say I would think it'd be a very minimal role. But regardless of what's taking place in this skin in the neck, the toxins and the pathogens that you have anywhere in your sinuses, pharynx, upper respiratory tract, and in these areas of chronic pathogen colonization that I've just described, only have one place to go, and that's to be swallowed. And remember earlier we said all toxins damage the same way. They cause oxidation. So you're having the same final common pathway of toxicity, increased oxidation only in your gut. And we see the increased incidence of ulcer disease, also bowel cancers. All of these have been associated with pockets of oral and periodontal bacteria at the sites before they evolve. Same thing with breast cancer, periodontal pathogens in the breast. Same thing with heart disease, pathogens in the coronary artery endothelium.
I remember reading that I think Nick Gonzalez said it, that tumors are full of toxins, and when they break apart suddenly in the phenomenon known as tumor lysis, the person can go into a coma and die from the quick release of the toxins in the tumors. Have you heard of this?
Well, I haven't heard about it being so dramatic as to go into a coma and die, but definitely when you have a large mass of cancer, okay, a physically large mass of cancer, and you use an agent, maybe chemotherapy, maybe vitamin C, maybe hydrogen peroxide, that can rapidly kill a large number of the cancer cells in short order. Yes, the cancer cells lyse. They release a lot of pro-oxidant byproducts into the blood, pro-oxidant meaning causing oxidation. And they also selectively accumulate iron, so they release huge amounts of free reactive iron into your lymph system and blood as well. And this is very, very highly pro-oxidative. So as long as that condition exists where you have a big release of these pro-oxidant debris, if you will, into the blood, you'll have a patient that's feeling worse.
Is there something somebody can do on their own using hydrogen peroxide to sort of wash their lymphatic system from the mouth?
Absolutely. This is something I've been writing about quite a bit. And not only can it normalize your gut, it also, and I'm going to use this dirty word, it cures colds, it cures flu, and it will cure COVID. Okay? COVID is nothing but a high concentration virus in your nasopharynx and your oral pharynx. And when you take in the peroxide, you knock it out, and then the rest of the body can mop up the virus that's elsewhere. Something to keep in mind, because we had a lot of people say a lot of negative things after President Trump talked about inhaling disinfectant several months ago. Well, he wasn't wrong. You don't want to inhale Lysol, you don't want to inhale bleach, but guess what? Hydrogen peroxide not only does the job we want it to do, but the lining of your respiratory tract naturally secretes hydrogen peroxide to protect itself against new inhaled pathogens. And when you have a larger pathogen load, you secrete more. And when you have a super high pathogen load, you get sick unless you're able to take in more hydrogen peroxide by nebulization to deal with it. So it's absolutely nature's natural antibiotic, and there's nothing toxic. Matter of fact, this is another great part about it. When it's finished killing the pathogen, the residual byproducts are water and oxygen. So all you do is once you kill the pathogens, the remainder of what the hydrogen peroxide does is hydrate and oxygenate the tissue that had been infected to help accelerate the rate of healing even more rapidly.
It sounds like a win-win.
And I mean, people can have you can give them my email or whatever, and they
Please,
can.
actually, before I forget, please tell us the best way to contact you and to get a hold of your books and to stay in touch
Sure.
with you. It's fascinating.
My email, and this is the initial TE, Thomas Edward, TE, last name Levy, Levy as in Victor, YMD, TELEVYMD at yahoo.com.
Okay, great. And I'm really fascinated by what you said about hydrogen peroxide. You can gargle with it. Would that be safe?
You could gargle with it. A lot of people do, and it is very safe. It's very effective. And that will probably suffice 9 out of 10 times. The thing is, though, once it starts getting in the upper airway, you need to facilitate the inhalation of the peroxide.
How do you do that?
With the nebulizer.
Oh, with the nebulizer.
Yes, the nebulizer. Yes.
A little different than a diffuser, right?
Yes, yes. But I mean, they're very common. I mean, kids with asthma, you see the little mask on and they're inhaling mist. Oh. So that's it. You just have a little chamber and you do the right concentration of peroxide with or without other things if you want that are good for you as well. The nebulizer forces air in there, turns it into a mist, and you inhale back and forth the mist. Works extremely well.
So this is just regular old hydrogen peroxide you can buy in the pharmacists?
Yes, that will do in a pinch. In other words, if you're sick and you can only get that, get it and use it, and don't worry about some of the minuscule amounts of other agents in the peroxide. But if you're going to do this as a lifestyle, which is also a good option, then you go to the trouble of ordering online or going somewhere and finding food-grade hydrogen peroxide.
Ah, okay, good. This is really fascinating. It's cheap, it's effective, it's safe.
The important part about this too is it's sort of good news, bad news. The bad news is I'm pretty sure this is not going to be our last pandemic. The good news is if you're paying attention to what I'm telling you, you now have a lifelong way to deal with any new virus that comes into your realm. There's really and truly, and I say this absolutely 100% sincere and confidence, if you do what I'm talking about with the peroxide, you need never suffer from a cold or flu again, period. Okay? Until they manufacture some virus that's resistant to hydrogen peroxide, but that doesn't exist right now.
Can you say that it's a very good detox, like vitamin C would be?
Not so much a detox. It's a oxidizing agent. So it, however, it's let me step back. Under the right microenvironment, hydrogen peroxide does have antioxidant as well as oxidant properties. So some people, I'm not quite sure I'm ready to jump to this, but some people view hydrogen peroxide as an important nutrient. And considering the fact that it is present in every cell of your body, constantly being produced, everywhere in the extracellular space, concentrated in your urine, concentrated in your breath, even if it's not a primary nutrient, it's a primary protector.
Now, you've written about vitamin C also. Would you say vitamin C is more of a detox used as IV?
Well, it depends on what you're using it for. That's the unique thing about vitamin C. Vitamin C, when you have an infection or infected cells, it goes into the cell, it contributes an electron to ferric ion, which goes to ferrous, contributes it to peroxide, and the peroxide makes hydroxyl radical, and that's the most potent oxidizing agent known to man. When that microenvironment is not present, all vitamin C does is supply antioxidant protection everywhere else. It's also interesting because I've written a lot about vitamin C, and it turns out, and I didn't realize this until recently, that one of the primary ways that vitamin C exerts its antipathogen effect is via hydrogen peroxide as the final common denominator. And outside of the cell, it's a primary stimulus to producing more hydrogen peroxide. So they truly do work hand in glove, if you will. And let me say this, I want other people to understand too. Even though the peroxide nebulization has the ability to be a monotherapy to deal with COVID and other respiratory viruses, by no means am I saying do this and nothing else. I mean, you should take your vitamin C and your magnesium and your vitamin D, your vitamin K2, and your iodine. Those are what I call the big five, and any other good chronic nutrients you can find, but always take those top five, especially the C, the D, and the magnesium.
Yeah, and this would, of course, dovetail with when we met at the
There you go. Yes, sir.
And is your diet more like that, the Weston Price traditional nourishing traditions?
You know, I would eat better if I weren't so often cooking for myself. So, I mean, but I have no problem with altering my diet when it's easy, but it's just, I'm not a good example for that. I definitely could use more vegetables and less meat. I have no doubt about it. But there are other things that I pay very close attention to, and that's avoidance of calcium and other things like that that will absolutely put you in your grave quicker.
So we're running over, but I find you such a fascinating interviewee, I guess you could say. I just wanted to keep you on a little longer.
Sure.
I'd like to thank you. This has been just incredible. You've opened up so many doors and opportunities, I think, for people. And I'm glad that you have your JD license as well as your MD. I imagine it might scare some people away from trying to attack you.
I like to say that with my MD and my JD, I'm gradually becoming a member of every profession I hold the lowest esteem.
And you're courageous also.
Well, I suppose.
Thank you. This has been just a real pleasure. And
Okay.
it's been great. I recommend everybody get turned on to Dr. Levy's books. And you have many articles and journals, I assume?
Yes, I gave you the email. The website is simple. It's peakenergy.com.
Oh, okay. And you have, I guess, blogs, articles, things of that nature.
Articles, yes. Articles and the books and all that.
Thank you again, Dr. Levy. It's just been a pleasure.
All right. My pleasure. Take
Thank
care.
you. Bye-bye.
This show has been produced by Market Domination, LLC. To discover how you can have your own show completely done for you and turn it into a real published book and become the authority in your marketplace, go to www.marketdominationllc.com/podcast offer.